Good morning. Good morning. Good morning. Several members of my cabinet, as well as local and private health providers and partners, are here today to update Ohioans on the state's effort to keep our communities healthy and to discuss our multifaceted efforts to prepare for the H1N1 flu in Ohio. First, let me give just a brief history of this virus. In April, we saw the emergence of a new form of flu spreading across North America. At that time, cases of H1N1 flu appeared in Ohio. In June, the World Health Organization declared the situation a full pandemic, or a global spread of the disease, the first such designation in 4 decades. I'm sad to say that we believe at least 4 Ohioans have, at least reportedly, lost their lives as a result of H1N1. Because of this spread of the virus and the likelihood of increased cases in Ohio, state government has been working to develop a preparedness plan so that we are able to respond quickly and as necessary. However, prevention is a shared responsibility, and all Ohioans must understand their personal role in keeping themselves, their families, and their communities safe and healthy. Since April, state agencies have been reviewing our pandemic preparedness plans, making necessary adjustments, and determining actions that will be required this fall and winter as we support local governments, healthcare providers, and members of the public. Earlier this morning, I signed an emergency proclamation that will mobilize the resources that various agencies may need to respond to this developing situation. Most critically, it allows emergency medical technicians to perform immunizations such as those for H1N1. This adds about 17,000 potential vaccine providers who can be utilized if we need them. Also, this week, we are distributing a portion of the state's stockpile of the antiviral medications and supplies to hospitals and health departments across our state. My public health staff and our local health departments have agreed that it is preferable to send the material to local health departments now rather than later in the flu season. This way, the antiviral medications are available quickly if and when they are needed. Last Friday, we also took action to order our first allocation of H1N1 vaccine. Let me take a moment to remind everyone that the vaccine distribution will speed up as more manufacturers make the product available. Later, Dr. Jackson will speak more about this issue, but I encourage all Ohioans to be patient and diligent in seeking their vaccine. It will go first to those who run the greatest risk of severe health effects from the virus. Also, a vaccine program of this scale requires a monumental amount of planning, coordination, and execution. As experts at the Centers for Disease Control and Prevention told Americans last week, there will be rough spots in the road, but we have been assured there will be plenty of vaccine for those who are vulnerable to the disease. I strongly urge Ohioans to continue taking those simple health precautions to help slow the spread of the flu. By continuing to cover your coughs and sneezes, preferably by coughing into your elbow, and we urge people to stay home or to stay away from school if they become sick. With all this talk about the H1N1 virus, I remind Ohioans not to overlook their seasonal flu shots. Ohioans should speak to their doctor or healthcare provider to see if the flu shot is appropriate for them. State government will maintain operations in an emergency and protect the welfare, health, and safety of all Ohioans. Each of our state agencies has a pandemic coordinator in charge of plans to ensure continuity of operations should H1N1 significantly affect our state workforce. The state is also operating a call center about the flu at the Ohio Department of Health. And this call center will be open during business hours, and that number is 1-866-800-1404. In addition, we are updating www.odh.ohio.gov with information and news, health tips, and links to our local and federal partner agencies for more information. The Centers for Disease Control and Prevention are coordinating the purchase and distribution of millions of doses of vaccine and antiviral medications. Ohio has been working closely with the CDC to ensure that we receive materials as they are needed and as they become available. Ensuring government is ready to respond to any circumstances the flu may present is the responsibility of all of us standing here today. Department of Health Director Dr. Alvin Jackson will speak about what we are doing to provide